HPV, or human papillomavirus, is a virus that can cause changes to the cells of the cervix. This video will give more information on high-risk HPV testing. A pap smear is a sampling of the cells of the cervix and is used to screen for cervical cancer. HPV co-testing can be performed along with the pap smear to determine if you are at high risk for developing cancer of your cervix. Infection with certain types of high-risk strains of this virus can increase the risk for cervical cancer. Starting at the age of 21, all women should receive a pap smear every 3 years. For women under the age of 30, there is no need for HPV testing since many women will have the infection but get rid of it. For women over the age of 30, you should have an HPV test and a pap smear every 5 years. Current guidelines recommend testing every 5 years after the age of 30 until the age of 65. These tests are continued regularly to assess the risk of cervical cancer. A pap smear is a simple office-based procedure in which a speculum is inserted into the vagina and a swab is used to collect a sample of cells from the cervix. A negative test result means that you are not infected with the HPV virus. Depending on the results of your pap smear, your doctor will discuss with you what your next steps should be. Women with a normal pap smear and negative HPV have almost no chance of developing cervical cancer within the next 5 years. If you have a positive result, that means you have a type of HPV that puts you at higher risk for developing cancer of the cervix. However, that absolutely does not mean you already have it. Luckily, cervical cancer is one of the most preventable types of cancer. Your doctor will probably have you come back for colposcopy, which is basically using a microscope to look more closely at the cells of your cervix. Pap smear test results are usually available within 2 weeks, but HPV co-testing results may take slightly longer. Your doctor will contact you to discuss the results as soon as they are available. This is not urgent, so there's no need to worry in the meantime.